Welcome to Telehealth for AYA cancer patients and survivors. My name is Mike Roth, and I am an AYA oncologist at MD Anderson Cancer Center. Like many of you, the whole COVID-19 pandemic made us switch gears to deliver much of our care virtually. We had our fair share of growing pains and learned a lot as we sought to optimize virtual care and make sure our patients continued to receive high-quality care. So telehealth, or telemedicine, centers on holding patient appointments and consultations virtually, not face-to-face in the same room. Now, we all know that telehealth largely increased during the pandemic, but not many of us received a crash course in how to optimize its use. And many providers report little or even no training in telehealth. To fill this gap, our research team invested in learning how to improve telehealth by conducting qualitative interviews and focus groups with healthcare providers and AYAs about their experiences and their best practices for delivering and receiving care. As a result, we developed this brief, high-yield, efficient session to share what we learned about how to best address challenges of using telehealth and some strategies you can use to increase engagement with your patients and improve care. While this session is intended for healthcare providers as well as staff, it really is open to anyone interested in fine-tuning their telehealth skills. Let's switch gears now and talk about best practices for conducting telehealth visits. In the same way we deliver top quality care to our patients in person, we also want to mirror best practices in the virtual telehealth space. These may include practices you're already doing, in addition to new ones you may have not yet considered. In the next sessions, we offer recommendations on best practices to improve the virtual care experience for both AYAs and healthcare providers. As a reminder, these are based on interviews with key stakeholders involved in the care of AYAs with cancer, as well as AYAs themselves. Recommendations span from prepping ahead of telehealth visits to the nitty-gritty on the day of and even post-visit tips. Let's dive in. First, let's talk about the pre-appointment approach before diving into the details of the telehealth visits. Most clinics send out reminders for in-person visits, giving patients the heads up on where to show up. Well, you can do the same for patients you will meet virtually as well. Here are some additional recommendations to consider ahead of a telehealth visit to ensure a smooth and effective virtual encounter with your patients. Give clear instructions and expectations prior to the telehealth visit. Share instructions with patients on how to connect to the telehealth platform, any necessary downloads, and what to do in case of technical difficulties, or if the provider is going to be late to join. This can be done via the electronic medical record, patient portal, or when clinic staff communicate with patients to confirm the medical appointment. Advise your patients to locate a safe space when meeting virtually. This can help with privacy and patient confidentiality. For example, secure a private space. Don't meet while driving. Consider using earbuds or headphones. Clearly communicate the purpose of the telehealth visit, what to expect once they log in. Will they wait in a Zoom waiting room? Will someone greet them? Let patients know if and how they can share the meeting link with loved ones. AYAs told us it is really useful to include family members for support and to provide an extra set of ears.
I have family members who, if it were to be in person, logistically, they're not going to come because of the costs of the flights and all that stuff. So having it to be virtual allowed them to join in the call, which was also really helpful to have another set of ears listening.
Let's now fast forward to the day of the telehealth visit. Providers and patients shared the following would be very helpful for that visit. First, secure an appropriate environment. It is important to choose a quiet and private location for the telehealth session to protect patient confidentiality. Minimize potential interruptions and background noise to create a professional and focused environment. Avoid or limit the use of virtual backgrounds. Some patients felt uncomfortable with a virtual background. because they cannot tell what else was going on behind the provider. If using one, be sure to describe your setting when you connect to help the patients feel more comfortable. Prepare the technology. Ensure that your computer or device, your camera, microphone, and internet connection are all in good working order. Familiarize yourself with the telehealth platform or software you'll be using. Test it beforehand to address any potential technical issues. It's not unusual for our in-person or telehealth appointments to start late. If your telehealth visit will start later than planned, notify patients that you're going to be late. It's also a good idea to share instructions with patients ahead of the visit about what to do if the provider is going to be late to join. Many AYAs shared with us that they were concerned that they were not connected correctly when left in a virtual waiting room.
If the provider's not on schedule, it's really confusing to know when they're going to show up. At least when you're in the office, you're like, okay, this is a sure thing. I'm here in the office. The doctor's going to show up eventually. But on telehealth, sometimes it can be like you're not sure if you're not connected right or anybody's even there.
Let's now talk about recommendations to consider during a telehealth visit. Introduce yourself and connect. Treat telehealth visits like in-person visits by making those types of visits more patient-centered and more natural. Make small talk. Many AYAs felt interpersonal interactions with providers were highly limited during their virtual visits. It helps to build patient rapport, and it puts patients at ease in what may be a routine visit, but may also be highly stressful for the patient. Let's hear from one of our AYAs and what they said during the focus group.
Yeah, because when it's in person, it's a conversation. It's not like, what are your symptoms? It's more very like they talk first about socially how you're doing, professionally and personally.
Orient the patient to your surroundings. Who's in your room? Who can hear what's being said? This is especially important if you're using a virtual background or if you're in a public space. Communicate your actions if you're typing notes or looking at another screen. Let the patient know so that they know they still have your full attention. As you look away from the camera to type or look at your second screen, it may feel like, to some patients, you're distracted or you're not paying attention to them. Therefore, it's important to let them know you're taking notes, pulling up scans, and doing other things relevant to the visit. Set the agenda. Set the stage with the topics that will be discussed during the telehealth visit. Ask whether there is anything else the patient wants to discuss. Inform patients ahead of time or at the start of the visit if sensitive information will be discussed. Some patients wanted to know beforehand if sensitive information would be discussed, so they can secure a more private area, use headphones, or use a chat feature. Encourage patients to take notes if they'd like to, or if they have a caregiver or loved one in the room, they can take notes as well. Establish rapport with your patients. Give your full time and your full attention. In our focus groups, many AYAs shared that they feel more rushed during telehealth visits than during in-person visits. So make sure they feel like they have your full attention and your complete time. You can remind them that you are here to address all their concerns during the visit. Encourage patients to ask questions. Be intentional about the amount of time available during the visit while frequently encouraging patients to ask questions. Let patients know they are not being rushed during their visit and you have time to address their concerns. Show you are listening and consider longer pauses after your questions. Consider rephrasing patients' concerns prior to giving responses to let patients know you fully hear them. Occasionally, there's a delay in the audio, and it's important that you make time for this. Remember, any time that you are looking away from your screen, let patients know what you're doing, such as pulling up labs, taking notes, so that they know you are still fully present. Here's an important comment from one of our AYAs.
I also feel like with telehealth, I feel like it's limited the way I interpret it. That the provider is just like, all right, on to the next thing. All right, next on the list, let's go. But in person, I feel definitely that experience too, but it's way more in telehealth.
Share pertinent information during the visit. Use screen sharing when possible and appropriate. Many providers have not thought to share labs, share imaging, and other relevant patient information during the visit, and this can be extremely helpful. For example, you can share imaging and labs so you're both engaged together. Have an electronic version of shared resources that can be provided to the patient. Share screenshots, share links in the chat. Just like in-person visits where we provide patients with printed resources, we can do the same here. Allot time for patient questions. Ensure there is sufficient time for patients to ask questions and address them. Summarize what you've discussed during the visit, and importantly, provide next steps. And finally, let's talk about recommendations to consider after completing a telehealth visit. Again, it will be helpful to think about what your clinic does for patients at the end of an in-person visit and do those things in a similar way with patients you meet with virtually. One major suggestion AYA patients and survivors talked about was providing an email summary and next steps. Acknowledge whether the labs and notes will be available in the EMR patient portal. By engaging in these best practices, healthcare providers can enhance the overall telehealth experience for both themselves and for their patients. Remember, these practices aren't just about checking off a to-do list or checking another box. They're about building connections, fostering effective communication, and ensuring that quality care isn't lost in the digital shuffle. Before ending this session, we also want to acknowledge that some clinic and system level changes play crucial roles in shaping the telehealth landscape. Let's dive into some additional recommendations that could potentially further elevate the telehealth experience. Consider blocking off a time in your clinic to focus specifically and only on telehealth visits. It is often challenging to navigate alternating in-person and virtual visits in the same clinic session. Think about what your clinic does to prepare patients ahead of a medical visit. Do they follow up with the patient and confirm an appointment? Do they share instructions? Build on these best practices and integrate them into your telehealth visit. Develop a process for greeting patients when they enter the telehealth visit. This could be a background with instructions, or ideally, a warm greeting from a staff member who lets the patient know how much time they should expect to wait, similar to someone waiting in a live waiting room. Assign a nurse or a medical assistant to meet with the patients first, to do introductory vitals or something similar, or a review of systems, so that the provider then has more time to spend focusing on patient needs. You may also have some tips and tricks that we did not share. Please share those with your colleagues, your trainees, and other members of your team. And please also share your feedback in the survey link. We sincerely hope that you found this session helpful for both you and your patients, and we thank you for joining us today. If you have any questions or need a virtual high five or fist bump, we're just a message away. Here's to delivering top quality telehealth and increasing the reach, impact, and convenience of the great care you provide. Until next time.